anatomy text just refer to the abdominopelvic cavity and don't worry too much about the distinction. But we do differentiate the thorax from the abdomen. That intervening structure is, of course, the diaphragm. Now, in an image like this, I would expect, for example, although we haven't talked about these structures at this point, you to recognize that the immediately underlying the diaphragm on the right side is the liver, and that, for example, the liver extends across the midline as what we call the left lobe of the liver. We'll talk about its anatomy later. The stomach, the esophagus, we pass this through the esophageal hiatus of the diaphragm to descend on the left side, and then the stomach receives the esophagus on the left side and then proceeds or continues anatomically over to the right side adjacent to the gallbladder. So again, what I'm suggesting here is that you be familiar with the general organs and tissues that are present in the upper abdominal cavity. Now, the little region that is colored pink here, I had another illustration. Region that's colored pink is the abdominal cavity proper. And then this region down here that is dark green is called the true pelvis. The superior or greater pelvis continues on up to the iliac crest. But we're not going to worry too much about that right now. We're just going to say that all of this is the abdominal cavity, and then we'll talk about the boundaries of the pelvic cavity later. But in general, if you look at this, you can see that if you use the pubic symphysis and the sacrococcygeal system posteriorly, the pelvis sort of, the opening of the pelvis sort of begins at the top of the pubis to the apex of the sacrum, and then inferiorly from the bottom of the pubis to the tip of the coccyx. And then everything below that, I don't think it's labeled here, is called perineum. Perineum. So we have a nice cadaver image here of the structures. We can see the liver over here. We can see the gallbladder there. We can see the stomach here. See the viscera, the intestines inferior to that. This is a fairly vulnerable region to the extent that only the most superior portion is protected by a bony cage. So from an anterior perspective, we can see the relationship between the abdominal cavity and the pelvic cavity. Don't be fooled by this image. Remember that light green region that this particular image is labeling pelvic is actually only in the posterior region. Anteriorly, this abdominal cavity continues down to what's called the pelvic rim, and we'll sort through that a little later. That's one of the few things we need to address upon conclusion of this unit. But there is no fascial membrane. There is no precise anatomical delimitation between the abdominal cavity and the pelvic cavity. Rather, it's just this little bony ridge that we'll talk about later. And then this, I guess that's orange down here. Everything inferior to this membrane, which is called the pelvic diaphragm, it's chiefly a muscular and aponeurotic membrane. This is the region. These are the urogenital structures between the legs. And again, they have the term here. The term is perineum. Yes, in the upper left there. Perineum. So you have a lot of words that we haven't finished yet. A lot of words that begin with PER. Don't confuse perineum with perineal. Right? You know what perineal means. We have to talk about the peritoneum. So we have a lot of words that can be potentially confusing. We saw something like this at the beginning of the semester, the quadrant system that is sometimes used clinically to differentiate regions of the abdominopelvic cavity. As before, the more commonly used system is just the quadrant system here, the right upper quadrant, the left upper quadrant. For example, you should be able to tell me if the spleen is in which quadrant the spleen is located in, which quadrant the appendix is located in the system. But what I would ask that you be familiar with here are just a couple of things. First of all, be familiar with the terminology of these regions. And then also, you need to be familiar with the planes that are used to delimit the quadrant system, the nona quadrant system that you see here. So we have the two midclavicular planes. We talked about the lines that extend halfway along the clavicles. Then we have this plane, which we've seen before. This is the subcostal plane, which just corresponds to the inferior margin of the rib, the costal margin. This one is a little bit new. We talked about, I don't know if we talked about this or not. Remember, we talked about this one, which is not used. Let me erase this so we don't get confused here. Do you remember what that plane is called? I hear these. Excellent, supracrystal. But that one's not used here. Rather, what we're using for that inferior lateral plane in this case is sometimes called the transtubercular or the intertubercular. And what we're talking about here is the plane designated by the anterior superior iliac spine on each side. So that would be the approximate location of that. So those are the planes then that we use for this nona or an 8-quadrant system. Oh, I'm sorry, 9-quadrant system. Already getting tired here. So be familiar with the terms epigastric, umbilical, pubic. Notice that in some of these naming schemes, the groin region becomes the inguinal region. So just be aware of the variant terminology. Here we have the hypogonic, right and left. The lumbar region is the flank and the alternate terminology. So just be aware. This is, I think, more of a European terminology on the right side of our illustration. All right, so let's take a break. Actually, we're finished, right, with the anatomy. All right. That's a good point to stop because this is going to be a bit of a chore, so we'll pick up there next time.